4 million people in the United States are currently living with an autoimmune condition that is systematically draining moisture from their bodies. The vast majority of these individuals, roughly 90%, remain completely undiagnosed. In the brief period it takes to finish this video, several thousand more will join their ranks without realizing it. They will mistakenly attribute their chronic cottonmouth to the natural aging process. They will continue to blame their irritated, burning eyes on excessive screen time. They will keep purchasing over-the-counter eye drops that provide a mere 20 minutes of relief and chewing gum that only lasts until their meeting concludes. Meanwhile, the actual systemic root cause, which accounts for every single one of these issues, will quietly damage their moisture-producing glands year after year. This silent destruction continues until a severe complication finally triggers a proper medical investigation. Consequently, we dedicate the necessary time to preventative education right here. By the end of this presentation, you will comprehend precisely what occurs inside the fluid-generating tissues of your face, specifically your salivary and tear glands, as they begin to fail. You will learn the medical designation for this condition, a simple diagnostic check you can perform at home, the specific foods that exacerbate the issue, the dietary choices that soothe it, and a daily routine that frequently restores genuine comfort and natural moisture within a month to 6 weeks. Let me speak plainly about the information you have likely received previously. The narrative that a parched mouth is merely a consequence of getting older, that irritated eyes are just a minor inconvenience, or that prescription medications are the sole reason you wake up with your tongue stuck to your palate at night is fundamentally incomplete. The reality is that these symptoms often point to a distinct autoimmune disorder known as Sjögren's syndrome. The name is pronounced as Sjögren's. It was initially identified in 1933 by an ophthalmologist from Sweden named Henrik Sjögren. For nearly a century, it has remained one of the most frequently overlooked autoimmune disorders in modern medicine. The Sjögren's Foundation calculates that 4 million Americans live with this illness, and approximately 9 out of 10 patients are female. While the typical age at formal diagnosis is in the 50s, the initial symptoms generally manifest a full 10 years prior. Furthermore, the typical delay between the initial onset of symptoms and an accurate diagnosis spans 3 to 5 years, though some individuals wait a decade. This next piece of information should completely shift your perspective on the condition. Left unmanaged, Sjögren's does not merely cause physical discomfort. It elevates your vulnerability to a specific form of lymphoma by roughly 5 to 16 times compared to the general population. It can trigger inflammation in the kidneys, lead to scarring in the lungs, and cause neurological discomfort that mirrors diabetic neuropathy. Additionally, it coexists with other autoimmune disorders like lupus, rheumatoid arthritis, or thyroid disease about 50% of the time. Therefore, when I emphasize that this is more than just a dry mouth, I am highlighting the systemic nature of the condition. The visible symptom involves a lack of moisture, but the disease originates in the immune system, meaning the solution requires much more than another bottle of eye drops.
Let us examine what is occurring beneath the surface of your face. Your anatomy features 2 primary production centers for moisture. The first consists of your salivary glands, which are arranged in 3 distinct pairs. The parotid glands are positioned just ahead of and slightly below your ears. The submandibular glands reside beneath the floor of the mouth along the interior edge of the jawbone. Finally, the sublingual glands are located directly underneath the tongue. On a typical day, these units collectively generate between 1.5 to 2 liters of saliva. This represents an incredible volume of fluid produced by anatomical structures that most people never think about. The second system comprises your lacrimal glands, which are responsible for tear production. These are situated just above and toward the outer corner of each eye, concealed behind the bony structure of the orbital socket. They generate a constant, delicate film of fluid that simultaneously performs 3 essential functions. It purifies the surface of the eye, nourishes the cornea, which lacks direct blood vessels and relies entirely on tears for oxygen, and functions like a built-in cleaning system with every blink. Both sets of glands share a common structural foundation comprised of specialized cells known as acinar cells. These cells serve as the primary laborers responsible for manufacturing fluid whenever the body requires it. To visualize this process, imagine a highly efficient bakery that operates continuously every single day. The bakers, representing the acinar cells, produce tears, saliva, and the necessary moisture for your nasal passages and other delicate regions. Now imagine that this establishment retains a new security agency, and the guards mistakenly confuse the word baker with the word intruder. The security personnel begin systematically removing the bakers from the premises, resulting in some being terminated and others being injured, with the majority never returning. The ovens eventually lose their heat, and while the physical structure and equipment remain intact, there is no longer anyone inside to produce the goods. This scenario perfectly illustrates Sjögren's syndrome. Your immune system deploys white blood cells known as lymphocytes to infiltrate the glandular tissue and gradually eliminate the moisture-producing cells. This process is not an immediate assault. It is a slow, multi-year progression that moves from gland to gland. By the time your mouth feels dry enough to cause noticeable discomfort, 40 to 70% of the functional glandular tissue has typically been destroyed. This is why delaying evaluation by assuming the issue stems from blood pressure pills, antihistamines, antidepressants, or age allows the damage to compound in tissue that cannot easily repair itself. Before proceeding, it is crucial to recognize specific warning signs that mean you should pause this video, skip purchasing more artificial tears, and contact a physician immediately for an autoimmune evaluation. The first sign is a sudden painless enlargement of the glands near your ears or under your jaw, especially if the swelling persists for several weeks. This can indicate that the inflammatory process has intensified, requiring diagnostic imaging. The second sign is migratory joint discomfort that affects the knees 1 week, the hands the next, and the shoulders thereafter, particularly if morning stiffness lasts over 30 minutes. This pattern aligns with inflammatory arthritis, which frequently coexists with Sjögren's. The third warning sign involves unexplained numbness, burning, or tingling sensations in your extremities that cannot be attributed to diabetes. Sjögren's-related neurological damage is a well-documented issue that responds well to intervention when identified early. The fourth sign requires careful attention, which is a persistent, non-productive dry cough accompanied by shortness of breath during mild exertion like climbing stairs. Sjögren's can cause inflammation in the smaller airways and pulmonary tissue, a complication that necessitates evaluation by a pulmonologist rather than a simple throat lozenge. If you recognize any of these 4 specific complications, finish this guide and then schedule a medical appointment without delay. Clinically speaking, the condition generally presents in one of 3 distinct patterns, and you should consider which description aligns with your experience. The primary pattern is medically referred to as primary Sjögren's, where dry eyes and a dry mouth develop independently, often creeping up slowly and initially blamed on aging or medications. Blood analysis eventually identifies specific autoantibodies, most frequently the anti-SSA or anti-RO marker, which appears in 60 to 70% of patients. The remaining 30 to 40% of individuals test negative on standard blood panels, but a minor lip biopsy collecting a tiny tissue sample from the inside of the lower lip will reveal immune cell infiltration within the glands. This explains why numerous individuals are informed that their laboratory results are perfectly normal despite the active presence of the disease. The secondary pattern is known as secondary Sjögren's, which occurs when moisture deficiency accompanies an existing autoimmune diagnosis such as lupus, rheumatoid arthritis, scleroderma, or thyroid disease. If you are already managing one of these conditions and develop progressive dryness, it serves as an important clinical indicator. Approximately 30% of patients with rheumatoid arthritis and 5 to 20% of those with lupus also develop Sjögren's, which often remains hidden behind the primary diagnosis. The third pattern, which frequently misleads medical professionals, can be classified as mimic Sjögren's, Here, the physical dryness is profound and the chronic fatigue is debilitating, yet standard antibody tests remain negative, and further testing like a lip biopsy or salivary flow measurement is overlooked. Consequently, the patient is told their symptoms are merely a result of aging, stress, or medication side effects, allowing the disease to advance silently while alternative explanations are sought. Identifying your specific presentation pattern is essential for your future medical consultations. Consider the case of a patient named Margaret, a 64-year-old retired educator who is highly organized and a grandmother of 3. For approximately 6 years, she informed her family, dentist, and primary care physician that her mouth felt completely parched at night. Her dentist assumed the issue was related to her blood pressure prescription, offering a specialized rinse and suggesting sugar-free drops. Her general physician agreed with this assessment and noted her springtime allergy medication might be contributing as well. Her eye specialist diagnosed her with basic dry eye syndrome and recommended an expensive prescription droplet. By the time she consulted a rheumatologist, she had been carrying a water bottle everywhere for 3 consecutive years. She had abandoned going to movie theaters because her contact lenses felt like sandpaper scraping against her eyes during a show. Furthermore, she developed 3 dental cavities in a span of 18 months despite having no history of decay for 2 decades, and her tongue took on a smooth, slightly fissured appearance that was dismissed as ordinary dryness. The rheumatologist proceeded to ask 3 vital questions that no previous provider had raised. She inquired if Margaret experienced morning joint stiffness, to which Margaret noted her hands felt stiff, but she had blamed it on yard work. The doctor asked if her saliva ever felt unusually thick or stringy rather than simply absent, which Margaret confirmed, assuming it was a side effect of the dental rinse. Finally, the doctor asked if she had experienced periods of profound, unexplainable exhaustion that rest could not remedy, which Margaret recalled enduring for an 8-month period 2 summers prior. Subsequent blood tests revealed the presence of anti-SSA antibodies, and a diagnostic tear test involving a small paper strip placed under her eyelid for 5 minutes showed less than 2 millimeters of fluid production compared to the normal 10 millimeters. A salivary assessment confirmed a corresponding drop in saliva, leading to a definitive diagnosis of Sjogren's syndrome after she had likely managed the illness for over 10 years. We will revisit Margaret's progress shortly, as her outcome was highly encouraging. Now, let us clarify the precise mechanism behind these symptoms so you understand exactly why your body feels this way. Returning to our bakery analogy, the primary producing cells are gone or significantly diminished, yet the structural pathways leading from the glands to the ocular surface or oral cavity remain intact. These pathways function like empty delivery pipes leading from a warehouse. They remain operational but have no product to transport. Consequently, when you attempt to consume dry food, your salivary pathways attempt to respond but can only produce a minimal trickle because the underlying production system is compromised.
When you awaken, your tear pathways attempt to lubricate the eye, but the moisture layer is so thin that the eyelid creates friction against the cornea. This explains why standard eye drops provide relief for only 20 minutes before dissipating completely. You are merely treating the symptom from the outside rather than addressing the production issues within the gland itself. To alter this dynamic, you must quiet the overactive immune response and protect the remaining functional tissue. While you cannot regenerate cells that have already been lost, you can safeguard the remaining tissue and revitalize partially damaged cells, which typically leads to a measurable increase in natural moisture within 4 to 6 weeks. You can perform 2 practical assessments at home right away to gain clarity on your situation. The first is the cracker assessment, which requires placing a plain, dry soda cracker in your mouth and attempting to chew and swallow it without drinking any liquids. A person with standard saliva levels can typically accomplish this within 60 seconds without significant discomfort. Conversely, an individual experiencing Sjogren's level dryness will generally require water to swallow the cracker at all, making an inability to complete this test a notable clinical finding. The second evaluation is the morning eyelid check. Tomorrow morning, Prior to applying any drops or washing your face, look into a mirror and slowly open and close your eyes 10 times in succession. A properly lubricated eye will feel completely smooth, allowing the eyelid to glide effortlessly. An eye affected by Sjogren's will feel gritty, sticky, or create a sensation of friction as the eyelid moves across the surface. If you notice this friction, document it, because it indicates a level of dryness that goes beyond normal aging. While neither test provides an official diagnosis on its own, positive results on both indicate that you need to have a much different conversation with your healthcare provider. Let us discuss 3 specific dietary items and habits that actively worsen this condition on a daily basis according to clinical observations. The first item is alcohol, even when consumed in minor amounts or restricted to the evening hours. Alcohol acts as a systemic diuretic that removes fluid from your tissues, and it can exacerbate inflammation in the very glands you need to protect. Consuming a single glass of wine at night can measurably lower your nocturnal saliva generation. For someone who already has compromised glandular function, that marginal decrease can transform a restful night into a 3 a.m. awakening with a completely dry mouth. If you recognize these symptoms, you should view daily alcohol consumption as counterproductive to your health. The second factor is late-day caffeine intake from coffee, tea, or soda. While these beverages have mild diuretic properties, their main drawback is that they overstimulate the sympathetic nervous system, which naturally suppresses fluid production. A dominant sympathetic state directly correlates with increased dryness. If you consume caffeine after 2 p.m., you keep this system elevated during the exact hours your body needs to rest and rehydrate its glands.
Shifting your caffeine intake to the morning hours can produce a noticeable reduction in evening dryness within a single week. The third item is refined sugar, particularly the varieties found in processed snack bars, cereals, dried fruits, and confections. This ingredient causes harm in 2 distinct ways. First, sugar provides fuel for oral bacteria in an environment that lacks the protective antimicrobial cleansing action of normal saliva flow, leading to rapid dental decay as seen in Margaret's case. Second, elevated blood glucose levels are inherently dehydrating because the body draws moisture out of tissues and into the bloodstream to balance the sugar. Individuals with severe dryness who consume high-sugar diets frequently notice an intensification of their symptoms 30 to 90 minutes after eating. Eliminating these 3 specific triggers for 2 weeks can yield a substantial difference. Conversely, let us examine 3 habits and foods that offer genuine therapeutic benefits. The first is the consistent consumption of cool, plain water, though your drinking technique is critical. Most people dealing with dryness consume large amounts of fluid a few times a day, which is relatively ineffective. A far better approach involves taking small, frequent sips every 15 to 20 minutes throughout the entire day. This method works because your glands respond to steady, moderate hydration rather than sudden deluges of fluid. Keep a container of water within reach at every location you frequent, aiming to consume roughly 8 to 10 small sips each hour. The second recommendation centers on foods rich in omega-3 fatty acids such as salmon, sardines, and mackerel consumed 3 to 4 times a week. If you prefer plant-based options, 2 tablespoons of ground flaxseed can be stirred into oatmeal or yogurt daily. These fatty acids help reduce inflammatory signals from immune cells, and clinical studies published in specialized ophthalmology journals demonstrate measurable improvements in dry eye symptoms after 12 weeks of consistent intake. This represents one of the few dietary adjustments backed by reliable published evidence. The third intervention involves utilizing sugar-free xylitol gum or lozenges multiple times throughout the day. Xylitol is a sugar alcohol that inhibits the growth of cavity-causing bacteria, while the mechanical action of chewing stimulates your remaining salivary tissue. You can achieve a similar effect with hard, sugar-free candies used between meals to simultaneously encourage gland function and protect your teeth from decay. The following hourly outline represents the exact protocol I would recommend to a patient seeking advice in my clinical office. This routine does not substitute for professional medical care, but it is safe for the majority of adults to begin immediately. In the morning before rising, rinse your mouth with lukewarm water for 30 seconds and swallow to clear any film that developed overnight. Once upright, place a single drop of preservative-free artificial tears into each eye and blink slowly 20 times. Brush your teeth using a high-fluoride prescription toothpaste containing 5,000 parts per million, which is specifically formulated to protect dry mouths. For breakfast, choose options like eggs, oats, wild fish, plain yogurt, or berries while avoiding fruit juices, and drink water during the meal rather than afterward. If you consume coffee, restrict it to this morning window. Throughout the day, maintain a container of water nearby to ensure you take small sips every 15 to 20 minutes, and use a xylitol lozenge or piece of gum every 2 hours. If your eyes feel irritated, apply a drop of preservative-free artificial tears, keeping total usage to 4 or 5 times daily to avoid irritating the ocular surface. Your midday meal should consist of clean protein, vegetables, and beneficial fats. If you cannot consume fresh fish multiple times a week, consult your doctor about incorporating a high-quality omega-3 supplement, providing 2,000 milligrams of combined EPA and DHA daily with food. In the evening, avoid alcohol during the work week and limit consumption to a single glass with food on weekends. Aim to finish dinner before 7 p.m. Avoid subsequent sweet snacks, and perform thorough dental hygiene including flossing and a specialized fluoride rinse recommended by your dentist. Ensure you inform your dental provider about your symptoms during your next communication. The hour prior to sleep is the most critical period for managing this condition effectively. Utilize a bedroom humidifier, particularly during colder months when indoor heating drops humidity levels below 30%, which drastically worsens dryness. Apply a small amount of lubricating eye gel instead of standard drops before sleep. This will temporarily obscure your vision but protects the cornea during hours of rest. Place a glass of water on your bedside table for nighttime use, and consider raising the head of your bed slightly by placing a wedge under the mattress to minimize nocturnal glandular congestion. Committing to this routine for a month to 6 weeks typically yields a measurable enhancement in daily comfort rather than a total cure.
To be completely transparent, this condition cannot be entirely cured at present, but it can be managed to a degree that restores a high quality of life. Margaret initiated this exact routine the week following her rheumatology evaluation. Her specialist also initiated a first-line systemic prescription medication called hydroxychloroquine alongside pilocarpine, which helps stimulate remaining salivary function. Any medication decisions must be evaluated with your personal health care team to ensure they align with your health history. Within 2 weeks of starting her regimen, Margaret could successfully swallow a dry cracker without fluid, and by 6 weeks her morning eye irritation had resolved. By the 12th week, her saliva levels had improved sufficiently to allow her to sleep through the night without waking up for water, and her subsequent annual dental checkup revealed 0 new cavities. She maintained her active lifestyle with her family and returned to enjoying movies comfortably. Her successful outcome is entirely typical of what occurs when the condition is accurately identified and managed with consistency. Before concluding, I want to provide 5 specific actions you can take over the next 12 hours to change your health trajectory. First, perform the cracker assessment tonight and record your findings. Second, conduct the morning eyelid friction check tomorrow before using any products and note the result. Third, ensure your final caffeine serving occurs before midday starting tomorrow. Fourth, acquire xylitol-based lozenges or gum during your next pharmacy visit and keep them with you. Fifth, contact your medical provider this week to request an autoimmune laboratory panel including anti-SSA, anti-SSB, ANA, and rheumatoid factor, specifically noting your chronic dryness. Using precise terminology helps medical professionals respond effectively to your concerns. Taking these 5 steps tonight can alter the course of your condition. I would like to learn more about who is engaging with this content, so please share your age and location in the comments section below. Autoimmune patterns tend to intensify noticeably after age 55, with a significant concentration of Sjogren's diagnoses appearing in the late 50s and 60s. Location also plays a critical role, as arid environments like Arizona, Nevada, New Mexico, West Texas, Utah, and parts of Colorado or California can make managing these symptoms considerably more challenging. I review these entries carefully, and they help inform the focus of future educational videos. Please share your age, location, and which specific symptoms resonated with you today. Remember that your symptoms are not merely an inevitable sign of aging, normal fatigue, or entirely the fault of your current prescriptions. This is a specific clinical condition with a recognized name, clear diagnostic tests, and an established management protocol. While you may have to take the initiative to discuss these details at your next medical appointment, this educational information is meant to empower your conversations with a qualified clinician. True health advocacy begins with the knowledge you apply to your own life. I am Dr. Laura Chen. Please take care of your health.